Okay, we're going to look into the slides for the practical one Respi. The first image is bronchial asthma. So you can actually see this is a section of a lung, and in this lung you can see the air space in this area are patent and normal, but obviously in this airway, the airway is basically blocked by mucus plug. Okay, the whitish thing inside the lumen of the airway is actually the mucus plug in the airway or bronchus. The next one is chronic bronchitis. So basically we're going to look into the changes in the bronchus. Basically you can actually see that the wall of the bronchus is actually edematous, is actually thickened. Okay, the size should be around this size, but this is actually very thickened, and you can actually see there's a lot of mucus, as example in this one inside the lumen of the bronchus. Okay, the next one is emphysema. So this is actually a section of a lung parenchyma. So you should be able to see a normal lung parenchyma like this, but in these cases at this area you can actually see a lot of enlarged alveolar spaces. Alveolar spaces are not supposed to be visible through naked eye, but you can actually see the enlarged alveolar spaces here, and it is caused by destruction of the alveolar wall. So you can actually see there's supposed to be an alveolar wall here, but it's actually destroyed. There's supposed to be an alveolar wall here as well, but this is also destroyed. The next one is bronchiectasis. So you can actually see there's actually enlargement of the airway. So basically in normal instances, this is a normal airway in the center, and as it goes to the periphery, the airway should be very very small, not visible at all. But in this lower lobe, basically the airway persistently enlarged from the periphery, from the central to the periphery. So basically this means that there's actually the dilatation of the distal airway, and surrounding this tissue are consolidation. You can actually see the difference of the tissue up here and here. This is actually quite airy, and this is actually very dense, and this is what we call as consolidation surrounding the dilated airway. Features of bronchiectasis. Well, you are going to look into some of the virtual slide as well. First is bronchial asthma. So when you look into this link later on, click on this area, this button, to open up the slides. So basically when you open up the slide and you zoom, please zoom slowly because this website can be quite slow. So the 4 changes that you should be able to see in this slide is, if you just zoom into this the airway, because the airway is actually very prominent in the slide, there's actually chronic inflammation. You can actually see there's a lot of this small dots along this wall, as well as the lumen of the airway. So you can actually, those are actually lymphocytes, which indicates of chronic inflammation. And you can also see that the bronchi is basically very thickened, okay, and edematous, meaning that there's a lot of fluid in between the muscularis area of the wall. And you can also see that the thickening is not only because of the edematous fluid. You can actually see there's a lot of smooth muscle at the bronchial wall. Okay, so this is actually a feature of bronchial asthma. When you see there's a smooth muscle hypoplasia, basically the cells become a lot more than usual, and most prominently because of the mucus here must come from somewhere. So there's actually this mucus glands. The mucus gland becomes hypoplasia, or the number has become increased as well. The next one is chronic bronchitis. Okay, this is actually almost similar to bronchial asthma. So most prominently, you can actually see there's actually hypertrophy and hyperplasia of the serous gland, right? And you can actually see there's also lymphocyte infiltrates. Similarly, in asthma, you can also see there's a mucus plug inside the lumen of the airway. Okay, so this is actually the features of it, okay, that I see just now, that you can actually see chronic inflammatory cells there, right? And then you can see the mucus here, and these are actually the seromucinous gland, or the glands that produce the mucus inside the wall of the airway. Next is emphysema. So basically you can actually see there's actually section of the lung parenchyma, okay, and just focus on this area, because you can actually see there's actually an alveoli there and there. The normal one should be small as this, but this is actually enlarged, and the reason why it's enlarged, you can actually see there's actually an alveolar wall that is actually being destroyed there. So there's actually an alveolar wall there, and there is all become destroyed. So there's actually destruction of alveolar wall, making the air space become large. And the last one is bronchiectasis. So this is actually a tissue of the lung, so you can actually see there's something there, right? And this is actually destruction of the whole alveolar parenchyma, the tissue, because this is actually basically supposed to be a bronchial wall, okay? There's supposed to be bronchus there, but it got destroyed, and this is actually the bacterial colonies, and there's actually a lot of necrosis there and there, okay? This is all necrosis because definitely there's no tissue left, and this is actually infiltrated by neutrophils and form what we call as abscess. Alright, that's all.